Let's talk about a very important topic, vernal keratoconjunctivitis, also known as spring catarrh. So, what exactly is vernal keratoconjunctivitis and why is this something we need to be concerned with? Vernal means something which is associated with spring, and the addition of vernal in the name of this pathology is signifying a very important epidemiologic point. And this particular concept will help you to differentiate vernal keratoconjunctivitis from other differentials when going over various clinical scenarios. Anyways, let's start the topic. Vernal keratoconjunctivitis is one type of allergic conjunctivitis. The addition of kerato in the name is signifying the involvement of the cornea in this pathology in many cases. So you must always be mindful if a conjunctivitis is preceded by the prefix kerato. Anyways, let's now start with the topic. Obviously, in the etiology, we have to realize that this is a hypersensitivity reaction, and there are elements of both type 1 as well as type 4 hypersensitivity. So this could be an MCQ. They can ask you which type of hypersensitivity is behind vernal keratoconjunctivitis pathogenesis. There are in total 4 types of hypersensitivity, with type 1 being called the immediate hypersensitivity and type 4 being called delayed hypersensitivity, and both of these are basically implicated in the pathogenesis of vernal keratoconjunctivitis. So that's the first important thing you need to understand before starting with this topic. Alright, so vernal keratoconjunctivitis most commonly occurs in boys living in warm and dry subtropical climates like the Middle East, like South America, and the Asian countries like Japan, India, and Thailand. Alright, we live in Pakistan, which is pretty near. Anyways, continuing on with this topic. So vernal keratoconjunctivitis is a type of allergic conjunctivitis which most commonly affects boys who live in dry and hot climates. Okay, na? So why the use of the term boy? Why not male? It is because mostly the affected people are in the age range of 5 to 15 years of age. So mostly children and adolescents are affected by this particular condition. So in any scenario of vernal keratoconjunctivitis, they will most likely mention a boy who is 12, 13 or 15 years of age who will present to you with the signs and symptoms of conjunctivitis, which is bilateral and recurrent. What does bilateral mean? Bilateral basically means that both the eyes will be involved. The pathology will involve both the eyes, and in the scenario it will be mentioned that the complaint is recurrent. It will be mentioned that last year or the year before that the boy presented with a similar complaint, and if they're being especially nice to you, they will mention that the boy presented with similar pathology last summer or last spring. There is a definite association between the occurrence of this pathology and springtime as well as summertime or any climate associated with a lot of heat. So again, very important, recurrence is something which basically defines this condition. It's not going to be one-off, it's going to be a recurrent condition. This pathology will repeat periodically, and during which season there's a definite association with seasons during spring or summer, and spring is literally in the name, vernal. Alright, continuing on, and in most cases there will be a family history of atopy, but not necessarily, but in most cases there will be a history of atopy signified as the family having more than usual number of asthmatics. So there will be people in the family who have asthma or who suffer from hay fever or some other form of allergy. So these are the important bits. So if there is a scenario of vernal keratoconjunctivitis, they will be sure to mention the fact that there is a boy or a girl who is in the age range of 5 to 15 who will present with signs and symptoms of allergic conjunctivitis, especially during springtime, and there will be history of previous recurrence during a similar time period last year or the year before that. Okay? And we have a basic idea of what sort of features are basically specific to conjunctivitis, stuff like lacrimation and hyperemia. But what differentiates allergic conjunctivitis from other causes of conjunctivitis is itching / pruritus. So this will also be mentioned in the clinical scenario because itching will be present in virtually all cases. Itching of the eye, aka ocular pruritus. Alright, let me just show you where I've written this. Ocular pruritus. Let me make this in green, so this is something you do not miss. Continuing on with the topic, the eye involvement is bilateral, right? So it's not going to be something which will be involving one eye, which can be seen in certain other conditions. And the presence of giant cobblestone-like papillae on the upper tarsal conjunctiva. So this is a pathognomic feature. So we're done with the history. What about the clinical signs? On the basis of the presence or absence of certain specific clinical signs, we divide vernal keratoconjunctivitis into a palpebral form, a limbal form, and a mixed type. Starting with the mixed form, this one basically, there will be hyperemia of the conjunctiva, and there will be the presence of papillae on the upper tarsal conjunctiva, which can only be seen when the eyelid is everted. Now, if you remember your basic introduction to conjunctivitis, in the basic introduction, conjunctivitis was classified into two main types based on the type of conjunctival reaction. There was a follicular type, which was most common when the etiology was either viral or gonococcal. The second type was a papillary type of conjunctivitis, in which the etiology was either an acute allergic state, such as this one, an allergic state, or something like a very severe infective etiology, right? So this is where we studied papillary reaction as a means of classifying conjunctivitis into follicular or papillary. This is an allergic state, so papillae are going to be inevitably associated with it, and in this case the papillae are present on the conjunctiva lining the upper eyelid, and these papillae are quite large. In addition to being large, they are polygonal and they have flat tops. These papillae can be visualized when the upper eyelid is everted, and what exactly is seen? On the upper tarsal papillae, on the upper conjunctiva, you will see papillae which will be discrete, which will be large, and because of their arrangement, they will give a classic cobblestone appearance. Also, basically, they will be resembling pavement stones. So, in the first clinical type of vernal keratoconjunctivitis, known as the palpebral form, the pathognomic feature is the classic cobblestone appearance of the upper tarsal conjunctiva when everted in order to visualize it, and this appearance will be because of the presence of polygonal papillae with flat tops. Occasionally, the papillae are very gigantic because of the severity of the infection. My apologies, because of the severity of the pathology, and they will basically look like cauliflower. As I mentioned previously, when we were talking about conjunctivitis in general, conjunctivitis can be divided on the basis of the discharge into watery, mucoid, mucopurulent, or purulent. Watery discharge was mostly associated with viruses. Mucoid discharge is associated with viruses and with allergy. And in the case of palpebral form of vernal keratoconjunctivitis, there is the presence of thick mucoid ropey secretions. This is important and will likely be mentioned in a clinical scenario when they're trying to hint at vernal keratoconjunctivitis. This is important. Let me just underline this too. Alright, so the second type is the limbal form. So why are we interested in this type, and what does limbal form mean? Right? So the limbal form of vernal keratoconjunctivitis is seen in dark-skinned individuals of Africa and India. Alright, so now let's talk about the various features of the limbal form, and this will be important when we're doing the clinical manifestations. Alright. Alright, one thing I missed was that the thick ropey secretions are generally found together with the tarsal papillae. Now let's talk about the limbal form. The limbal form evidently involves the limbus of the eye. And what is the limbus of the eye? It is a thin border between the cornea and the sclera over here. Okay? So there is something very pathognomic for the limbal form of vernal keratoconjunctivitis, and this is something which is quite likely to come up in a scenario: Horner Tranter spots, right? So what you see over here are Horner Tranter spots, and how would you define Horner Tranter spots? They are discrete, meaning separate, white, superficial spots, and these are composed of dead epithelium and eosinophils, and they are found scattered around the limbus. So this is a very pathognomic feature and something you should not be confusing. Alright, let me just find this out for you. So this over here is one hornet ranta spot. Alright, and this is a white and a discrete and a superficial spot which is basically located on the limbus, or more accurately around the limbus, and which is basically composed of eosinophils and epithelial cells. Let me just point out another hornet ranta spot to you. So this one is also. So in addition to hornet ranta spot, there is an image in Titoi which is showing the presence of gelatinous papillae present around the limbal conjunctiva. So gelatinous papillae is also a keyword. Gelatinous papillae, and this is something you should, and that was terrible spelling on my part, is also something you should not be confusing. In addition to the palpebral type, in which you will see the classic cobblestone appearance of the upper conjunctiva on eversion of the eyelid, there is also the limbal form, in which you will see white superficial spots around the limbal conjunctiva which are discrete, called hornet ranta spots, and you will also see gelatinous papillae around the limbus, and in the first case you will also see thick mucoid ropey secretions. Now let's talk about the mixed type, which has the features of both palpebral and limbal. Alright, so initially when we basically were talking about the naming convention, we said it is keratoconjunctivitis because of the involvement of the cornea. So, is keratopathy associated with both types? Yes, but it is more commonly associated with which type? It is more commonly associated with the first type, the palpebral type. So what will you see on the cornea? Punctate, pinpoint epithelial erosions are the first finding, they're the earliest finding. There will also be epithelial macro erosion and ulceration. In addition, there will be the formation of something called a shield ulcer. And why do shield ulcers form on the cornea? Because there is epithelial macro erosion, and the bare area that is left behind becomes coated with desiccated, yani dehydrated mucus. So because of that, there is the appearance of a shield ulcer. There is also subepithelial scarring, which always happens whenever there is damage. And because of the chronic inflammation, there might also be peripheral superficial vascularization. So we're done with the important bits.